She's seen Encanto more times than she can count. And she can count to 10. She mentioned Mirabel in every conversation. But the moment she actually met Mirabel, she was speechless. That's pura magia. Find yours at Walt Disney World Resort.
5 years, 10 months, and 2 days. That's how long it took to grow the 38 inches to ride on Cali River Rapids. But the moment the wait finally ended, that was pura magia. Discover it at Walt Disney World Resort.
Where'd you get those shoes? Easy. They're from DSW. Because DSW has the exact right shoes for whatever you're into right now. You know, like the sneakers that make office hours feel like happy hour. The boots that turn grocery aisles into runways. And all the styles that show off the many sides of you, from daydreamer to multitasker and everything in between. Because you do it all in really great shoes. Find a shoe for every you at your DSW store or dsw.com.
Hello, I'm Joya Putnoy, a production assistant at Wonder Media Network, and I'm so excited to be guest hosting this episode of Womanica. This month, we're talking about architects. These women held fast to their visions for better futures, found potential in negative space, and built their creations from the ground up. Let's go back to the turn of the 20th century, New York City. Industry is thriving, but so is disease. Manhattan's Lower East Side has been dubbed the suicide ward because of rampant sickness and infant mortality. Sanitation is abysmal. Typhoid, dysentery, and smallpox spread like wildfire through crowded tenement buildings and sweatshops. Today, we're talking about the woman who saw a different way forward and who made it her life's work to restructure public health. Please meet Sara Josephine Baker. Sara Josephine Baker, who often went by Joe or Dr. Joe, was born in 1873 in Poughkeepsie, New York. Jo had studied hard to attend Vassar College, her dream school, but when she was 16, both her father and brother passed away. In light of her family's new financial circumstances, Jo decided to pursue medicine to support herself, her sister, and her mother. She enrolled in Women's Medical College at the New York Infirmary, one of the few medical schools that accepted female students. Jo graduated in 1898 and accepted an internship at the New England Hospital for Women and Children in Boston. There, she delivered babies for poor women in overcrowded and unsanitary tenement housing. It was the first time she witnessed the suffering caused by poor public health that she would later try to eradicate completely. After a year, Jo packed up and moved back to New York City to practice medicine. In 1902, she was hired as a part-time inspector for the New York Health Department. As part of her job, she performed health inspections on the city's school children. Jo called the assignment a pathetic farce. She was expected to visit 3 schools per hour, far too much work and too little time to make any significant impact. Jo was also tasked with visiting tenement buildings. Often, other inspectors skipped these visits altogether, opting to forge their health reports instead. She later recalled a conversation with another inspector who complained about Jo's work ethic. But if we don't report any sick babies and you go ahead and report shoals of them, it makes our reports look pretty bad. In Jo's case, hard work won over slacking. In 1908, she was appointed to head the brand new Bureau of Child Hygiene, the first department of its kind in the United States. Jo wanted to use her position to pioneer a new way of approaching public health. Instead of merely treating diseases once they took hold, she wanted to prevent them altogether. She dispatched nurses to visit new mothers living in tenement buildings in Manhattan's poorest neighborhoods. These nurses instructed women on various preventative health measures: breastfeeding to avoid potentially contaminated milk, frequent bathing, properly ventilating homes. That kind of advice may seem like common sense to modern listeners, but back then it was revolutionary. The proof was in the results. Previously, summers in the city had been particularly deadly, with 1,500 children dying per week on average. But after Jo launched her nurses program, total death dropped by 1,200 in the district where it ran. Jo expanded the program, and within 3 years, the infant death rate in New York City had dropped by 40%. Jo also created the Little Mothers Leagues, an educational program for tween and teen girls to learn about infant health so their mothers could earn a living outside the home. Jo also set up health stations staffed by nurses around the city to perform wellness checks on infants. She established citywide school nurse programs. She developed a safe baby formula, which helped mothers who couldn't breastfeed or who needed to return to the workforce to support their families. She invented a new eye drop system that saved many infants from developing blindness due to congenital gonorrhea. Jo even designed a new kind of baby clothing that proved more convenient and breathable than traditional swaddles. She also pioneered research on the emotional needs of infants, becoming the first doctor to find evidence that infants actually need love as well as food and shelter to survive. By 1923, New York City had the lowest infant mortality rate of any major city in Europe and the United States. 35 states created infant and maternal health programs replicating Jo's work. There was even an attempt to create a national program modeled after the success of these health programs. However, the bill hit a major roadblock when, in an ironic turn, the American Medical Association came out in opposition of the bill. Their rationale was that if programs like Jo's received massive funding on the federal level, so many children and women would be saved from illness that there would be no longer enough incentive for young men to study medicine. Despite these ridiculous protests, the law passed. On the local level, Jo received similar criticisms that her preventative health programs were taking away work from male doctors. When New York University's medical school asked Jo to teach a course on public health, she told the dean she didn't want to teach at a school that wouldn't allow her as a student because of her sex. The university changed its policies soon after. And when she did finally teach, she had to endure blatant disrespect from her male students, which she called a gloweringly hostile audience. Jo herself was also not free of prejudice. Modern historians note that while she worked hard to ensure the health and safety of immigrant tenement communities, she also engaged in ethnic stereotyping, especially against the Irish. One of her most famous acts was tracking down Mary Mallon, popularly known as Typhoid Mary, in an attempt to curb outbreaks of the disease. Twice, Jo helped forcibly detain and quarantine Mary, raising ethical questions about the balance between personal freedom and public health. Still, Jo's reputation was overwhelmingly positive when she retired. At the time, the press credited her with saving roughly 90,000 lives through the program she implemented. She had also published 5 books, including her 1939 autobiography, Fighting for Life, and hundreds of articles during her career. And she served as president for both the American Child Hygiene Association and the Women's Medical Association. In her later years, she moved to Princeton, New Jersey to live on a farm with novelist and screenwriter Ida Wiley, who is probably also her romantic partner. Jo died of cancer on February 22, 1945 in New York City. She was 71 years old. All month, we're talking about architects. For more information, find us on Facebook and Instagram at Womanica Podcast. Special thanks to Jenny and Liz Kaplan for having me as a guest host. Talk to you tomorrow.
The Unshakables podcast is kicking off season 2 with an episode you won't want to miss. Join host Ben Walter, CEO of Chase for Business, as he welcomes a very special guest, Chairman and CEO of JP Morgan Chase, Jamie Dimon. Hear about the challenges facing small businesses and some of the uh-oh moments Jamie has overcome. Listen wherever you get your podcasts. Chase mobile app is available for select mobile devices. Message and data rates may apply. JP Morgan Chase Bank, N.A. Member FDIC. Copyright 2025. JP Morgan Chase & Company.
Experience vibrant senior living with award-winning services at Brightview Senior Living Communities. At Brightview, our residents enjoy resort-style amenities, daily programs, exciting social and cultural events, and delicious chef-prepared meals. But that's not all. Brightview residents also enjoy complimentary transportation, safety, security, and high-quality care if needed. Brightview Senior Living Communities. Learn more about the possibilities at brightviewseniorliving.com.